I'm Charles Bankhead of MedPage Today, reporting from the Society of Gynecologic Oncologists meeting in San Francisco. Laparoscopic surgical staging for endometrial cancer resulted in clinical outcomes similar to those of laparotomy, but with substantially less patient morbidity, according to a study reported at the SGO meeting. Dr. Joan Walker of the University of Oklahoma in Oklahoma City said that morbidity was one of the key outcomes evaluated in the study.
There's no question that laparoscopy improves the patient's experience of having a surgery. It decreases their complication rates. It decreases their hospital stay. It decreases their pain, their quality of life outcomes for 6 weeks in my study, 6 months in another study. So the patient's perception of their experience is enhanced tremendously. That was one of the endpoints of our trial. We proved that laparoscopy was better.
On the more important outcomes of staging accuracy and disease control, laparoscopy demonstrated that it is not inferior to open surgery.
The Society of GYN Oncology and the Gynecologic Oncology group were fearful that there could be something in the act of performing laparoscopy and manipulating tissues differently that could increase the rate of recurrence. It could change where the recurrences were going to occur, and it could increase potentially a person's chance of dying of that disease. And so today we were able to reassure everyone that's not the case. The incidence of recurrence in our trials was very low, and the pattern of recurrence was the same on both arms, and so the patient gets the best result from the trial that could possibly have been asked for, both improvement in their perception of their cancer experience as well as the equivalent outcomes in terms of survival and where the cancer was to come back and who was expected to come back on. There weren't any surprises in the evaluation of the data.
Now that laparoscopy has proved itself in a head-to-head study with laparotomy, patients and gynecologic surgeons can make more informed decisions about which procedure to choose when either one might be appropriate.
Absolutely. The patient may choose their doctor that way, I suppose, but the physician tends to do what seems right in their hands for that situation. And so if the uterus is too large to fit through the vagina, for example, then it may require an incision to get it out. So those decisions the physician understands a lot better than the patient. If the patient has metastatic disease, a lot of us will perform a laparotomy to resect that metastatic disease. And so what the physical exam findings are also will direct the patient's care towards open surgery rather than laparoscopic surgery or minimally invasive surgery.
From the Society of Gynecologic Oncologists meeting in San Francisco, I'm Charles Bankhead, MedPage Today.